Yes. Hello, my name is Dr. Chris Straka, and today I want to talk to you about bladder filling during prostate radiation. This is a critical subject facing men going through prostate external beam radiation. They have to manage their bladder filling every single day during their entire course of radiation. Let's draw a picture of the pelvis from the side. This would be the rectum. The prostate sits in front of that, and the bladder sits in front of that. When we aim at the prostate with radiation, we do give a margin around it with radiation, and the radiation dose goes a little bit beyond that. Thus, if the bladder is not full during radiation, a significant portion of the bladder can receive radiation dose, and that can cause short and long-term side effects. What can we do about this? We'll draw the same picture again, same rectum, same prostate, but this time with a comfortably full bladder, same margin, same dose around it, but this time a significantly smaller portion of the bladder is receiving that radiation dose. This will minimize short-term side effects and long-term risks from the prostate radiation. Now, how can we achieve this? We're not used to being aware of how full or not our bladder is. We know when we really have to go, we know that the bladder is empty after we've gone. We don't really know much more than that typically. What I ask my patients to do is before they come in for their first simulation, which we'll talk about in a minute, I want them to start being aware of their bladder. Start noticing when they can first feel it, but it's still comfortable. They could easily go and do a home project for 30 or even 45 minutes and then use the bathroom later. That point is the perfect place to be if you're a prostate radiation patient. I want you to come in able to feel your bladder, have some urine in it, but not be overly full. Now, when I say come in, what am I talking about? I mean the very first time you come in, after you meet your oncologist, it will not be for treatment. Rather, it will be for a CT scan, often called a CT simulation. This creates a ground truth of your body, and every day we're going to try to match to that ground truth. If things are off, we adjust until things are just matched up. So what some of my patients will do is they'll say, well, surely if a comfortably full bladder is good, an extremely full bladder must be great. And so they do something like this. Same rectum, same prostate, very full bladder. Now, if we draw on our same lines here, we see that this does do a great job of minimizing radiation dose to the bladder, but this is very uncomfortable. Usually men that have a bladder that is this full can only hold it for maybe 5 or 10 minutes, if even. Some days our machine is running a little behind. Some days you might have to wait for 10 minutes or even 15 minutes for your treatment. This can become very, very uncomfortable very fast. Having an extremely full bladder is not worth it during treatment. Rather, we want to have a comfortably full bladder during treatment. I do suggest my patients do a series of exercises or basically personal experiments before coming in for their CT simulation the first day. What I suggest doing is get a standard sized glass or a standard sized bottle of water that you use every day and start out by drinking 1 glass or bottle of water. Time yourself and see how long it takes for you to become aware of your bladder after drinking 1 bottle of water, and then how often until you really, really have to go. There should hopefully be a pretty big spread of minutes between when you felt the bladder becoming full and when you really, really have to go. With 1 bottle, that might actually end up being hours, which could be hard to time in real life when you're coming in for radiation daily. You can then repeat this experiment with 2 bottles, 3 bottles, and 4 bottles of water and find the optimal amount of fluid for you to take each day. Once you figure out your optimal fluid intake daily, then you just work that plan, drink that much fluid for your CT scan, and drink the exact same amount of fluid when you come in for radiation treatments each day. So, key takeaways. Number 1, plan ahead. do the bladder filling exercise at home before your initial CT simulation so that you have a plan for how much to fill your bladder with when you come in for your CT scan, and then you can do that same plan every day when you come in for actual treatments. Number 2, do not overfill your bladder. This is particularly important when you come in for your planning CT scan. If you come in with a massively full bladder for your planning CT scan, we are going to be obligated, we're going to have you have your bladder that full every day. Because remember, we're creating the ground truth, and the real you has to match that ground truth. The real you can't be here, it has to be here. Now we want a comfortable real you, ground truth, so the real you can match that comfortably every day. Number 3, do the same thing every day. Same thing every day. There's no need to make big changes here. We're just going to work our plan. We're going to have our bladder comfortably full. You can empty it after the treatment each day, go home, and have a great radiation therapy course.